Hello and welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. Today, we will once again discuss key events these past 7 days in the Middle East region across healthcare, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the respective ministries, organizations, hospitals, healthcare providers, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to July 10, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. This week's health developments across the Middle East showcased a mix of proactive governance, scientific advancement, and urgent humanitarian needs. In the Gulf states, governments launched significant healthcare policies and infrastructure initiatives, from new insurance mandates and digital health upgrades to major hospital expansion projects, underscoring a continued commitment to national health reform and Vision 2030 style transformation. At the same time, regional researchers and institutions delivered breakthroughs in life sciences, with internationally recognized studies in genomics and cancer care highlighting the Middle East's growing contribution to global health innovation. Meanwhile, biotech and pharmaceutical collaboration gained momentum, as countries pursued self-sufficiency in medicine production and cross-border partnerships to strengthen supply chains. However, these achievements were tempered by ongoing public health crises in conflict-affected areas. In parts of the Levant and Yemen, healthcare systems remained under immense strain from disease outbreaks, malnutrition, and war-related destruction. Wellness promotion campaigns and community health programs continue to encourage healthy lifestyles, tackling issues from smoking cessation to climate-related health risks, reflecting a region-wide emphasis on preventive care. Digital health adoption accelerated, with several countries implementing AI diagnostics, telehealth platforms, and electronic record systems to modernize service delivery. Hospitals were a focus of both construction booms in stable nations and challenges, illustrating stark regional contrasts in healthcare capacity. Finally, initiatives in population health management pressed forward, including insurance reforms for universal coverage, expanded screening programs, and humanitarian efforts targeting vulnerable mothers and children. So let's begin. Let's first discuss healthcare policy and government initiatives. Gulf governments advance major health policy initiatives aimed at strengthening healthcare systems and safeguarding public health. In the United Arab Emirates, UAE, authorities enacted new legislation to tighten communicable disease control and bolster public health security. Dubai issued a law to curb the spread of infectious diseases, requiring infected individuals to avoid travel and mandating reporting of cases, with enforcement beginning later this month. At the federal level, the UAE also legalized tobacco-free nicotine pouches as of July 29, a regulatory move intended to support smokers in quitting by providing a safer nicotine alternative. Saudi Arabia implemented a significant financing reform, effective July 1. All public sector healthcare institutions are now required to contract with health insurance companies, integrating insurance into government hospitals' operations. This new rule by the Saudi Council of Health Insurance aims to enhance efficiency and cost-sharing in care delivery. Saudi officials also continue to coordinate regionally on public health issues. The health ministry hosted a high-level GCC meeting on drug control in Riyadh, coinciding with the International Day Against Drug Abuse, where officials from Gulf states agreed on unified strategies for prevention, treatment, and rehabilitation of substance abuse disorders. Kuwait this week launched a major emergency care initiative. The health ministry unveiled a first responder fleet of 28 fully equipped ambulances and rapid response vehicles strategically deployed across the country. Inaugurated by the health minister, this fleet is a tangible expansion of Kuwait's national health strategy to improve medical preparedness and cut emergency response times, especially in remote and densely populated areas. Each first responder unit is staffed by certified paramedics and outfitted with advanced life support equipment, forming a mobile extension of the healthcare system to save lives in critical moments. Several countries undertook initiatives to build health sector capacity and invest in their healthcare workforce. Bahrain announced a wide-ranging support program to train and upskill 750 Bahraini healthcare professionals as part of a new Labour Fund, Tamkeen, and Supreme Council of Health collaboration. The package, launched under directives from Prince Sheikh Isa bin Salman Al Khalifa, spans 7 initiatives, sponsoring physicians through medical board certifications and specialist fellowships, supporting nurses in advanced qualifications, for example in midwifery, critical care, and nephrology, and, for the first time, extending funding to Bahraini dentists and allied health practitioners. Bahrain's health leaders noted that this second annual healthcare bundle builds on a successful program last year and will substantially expand career development opportunities for nationals in the sector, aligning with the kingdom's economic diversification and quality of life goals. Jordan received an international boost for its health system resilience. The World Health Organization welcomed the International Monetary Fund's approval of a $700 million Resilience and Sustainability Facility, RSF, for Jordan dedicated to pandemic preparedness and health emergency capacity. This marks the IMF's first-ever pandemic-focused RSF arrangement, intended to help Oman strengthen its public health emergency planning, financing, and response infrastructure in the wake of COVID-19. Jordan's Ministry of Health, working with WHO and the World Bank, identified policy measures to be implemented under the program, including consolidating health emergency budgets and governance frameworks as the country aims to fortify its ability to withstand future outbreaks. Oman reported encouraging outcomes from its ongoing health sector reforms. A new national survey found that public satisfaction with Omani healthcare services rose to 81.8% in 2025, up from 73.4% 2 years prior. This 8.4% improvement in satisfaction, attributed to the Ministry of Health's quality improvements and Oman's Health Vision 2050 efforts, reflects better patient perceptions of hospital cleanliness, staff care, and appointment efficiency. Notably, the survey indicated higher satisfaction with private clinics, 85%, than public hospitals, 80%, and also that expatriates reported greater satisfaction, 87%, than Omani citizens, 79%. The findings, released July 8 by the National Center for Statistics, underscore Oman's focus on health for all under the Oman Vision 2040 strategic framework. Governments in the region also took action in response to emerging health threats and to strengthen regional cooperation. Egypt declared a state of high alert in its veterinary and public health services after outbreaks of foot and mouth disease, FMD, were reported in neighboring countries. The Ministry of Agriculture's Veterinary Authority in Cairo rolled out precautionary plans, including early warning surveillance and emergency vaccination campaigns, to protect Egypt's livestock from the SAT-1 strain of FMD spreading in parts of Iraq, Bahrain, Kuwait, and Turkey. Egypt's swift response, raising epidemiological monitoring in border governorates and pre-positioning FMD vaccines, aimed to avert any incursion of the fast-moving animal disease, which could threaten food security and livelihoods if it reached Egyptian farms. Libya and Iraq, though outside the week's core focus, signaled future collaboration with discussions in March on signing bilateral agreements to develop health services in both countries. And region-wide, health ministers and officials used the occasion of World Hepatitis Day preparations and the upcoming Hajj debriefings to share best practices. The week thus illustrated a dual narrative. On one hand, Middle Eastern governments are actively implementing reforms, from insurance and emergency services to workforce and preventive policies, to strengthen their health systems, and on the other, they are remaining vigilant and cooperative in face of cross-border health challenges. Next is life sciences and research innovation. Scientific research and innovation in life sciences made significant strides across the Middle East, with several groundbreaking projects and studies announced during the week. Qatar emerged at the forefront of health research excellence. In Doha, Sidra Medicine revealed its role in a major international study on human adipose fat tissue, published July 1 in Nature Metabolism. Sidra's scientists co-led the creation of the world's first comprehensive single-cell atlas of human and mouse adipose tissue, providing a standardized global reference for fat biology. This landmark research, part of the Global Human Cell Atlas project, maps fat cell subtypes and gene expression at single-cell resolution, enabling new precision medicine approaches for metabolic diseases such as obesity, diabetes, and fatty liver disease. CIDRA's Dr. Luis Saraiva noted that defining a consensus cell atlas for fat will allow scientists worldwide to speak the same language about adipose tissue and accelerate breakthroughs in treating metabolic disorders. Also in Qatar, Weill Cornell Medicine Qatar, WCMQ, researchers published an influential study in The Lancet Oncology analyzing the nation's progress in cancer care and outcomes. The report, Qatar National Cancer Care and Research, Pioneering Strategies for Global Health Excellence, highlights how 2 decades of sustained investment, from the National Cancer Strategy, 2011, to the current Qatar Cancer Plan 2023 to 2026, have transformed Qatar into a regional leader in oncology. The study found that precision medicine and expanded screening programs, for example, widespread breast and bowel cancer screening, have improved early detection and survival rates in Qatar, although it also flagged remaining challenges such as late diagnoses in some populations and the need to boost cancer awareness and data systems. Qatari officials welcomed a follow-up comparative analysis published alongside, which explored opportunities for cross-border collaboration in cancer control between Qatar, Saudi Arabia, and Jordan, including data sharing on genomics and coordinated research to benefit populations with similar genetic backgrounds. Saudi Arabia also took steps to advance health research and innovation capacity. The newly established Saudi National Institute of Health, Saudi NIH, announced a series of 2025 health research grant opportunities targeting national priority diseases. These competitive grants focus on translational research and clinical trials in 3 key areas identified by Saudi health authorities: cardiovascular diseases, endocrine and metabolic disorders, such as diabetes and cancer. The initiative aligns with the Health Sector Transformation Program under Vision 2030, aiming to enhance the quality and impact of domestic health research and encourage innovation that addresses Saudi Arabia's epidemiological needs. By channeling funding into these domains, the Saudi NIH seeks to accelerate discoveries in prevention and treatment, for example, new cardiac interventions or diabetes management strategies that can directly improve public health outcomes. The week's announcements noted that Saudi Arabia's emphasis on research is part of its polio transition success as well, having achieved integration of polio functions into routine health programs by early 2024, the first country to do so. Saudi is now repurposing research and surveillance expertise toward other pressing health challenges. Elsewhere in the region, countries showcased their commitment to scientific advancement and self-reliance in healthcare innovation. Iran held its annual Iran Health Exhibition 2025 in Tehran, June 8 to 11, with the theme, From Dependence to Self-Reliance, where domestic manufacturers and researchers presented homegrown medical technologies. Officials highlighted Iran's creative resilience under sanctions, pointing to examples such as a Tehran-based tech firm unveiling an advanced surgical navigation system for neurosurgery and facial procedures entirely developed by Iranian engineers as a symbol of the nation's growing medical innovation capabilities. The government spokesperson at the expo praised Iran's scientific talent and the successful linkage of Iranian experts abroad with local industry through initiatives like the Connect Forum, which has built a 10,000-strong network of expatriate Iranian medical specialists to contribute to local projects. This effort is strengthening knowledge transfer and collaborative research, reinforcing Iran's healthcare system with global expertise. United Arab Emirates officials continue to prioritize research in emerging health fields as well. Emirates Health Services, for instance, has been integrating research on mental health and primary care, exemplified by its March rollout of 15 specialized mental health clinics co-located in primary healthcare centers and collecting data on outcomes to inform evidence-based expansion of community mental health models. Though launched earlier in the year, this innovative integration approach, Together for Mental Well-being, remained in focus as part of the UAE's National Strategy for Wellbeing 2031, and data presented this week indicated positive reception and improved early psychiatric intervention rates under the program. Across the region, academic institutions, often in partnership with government and industry, are scaling up research in genomics, vaccine development, and health technology. Egyptian universities continued work on the country's 100 Million Healthy Lives initiative by researching local genomics of hepatitis C and other diseases, building on Egypt's prior success in mass hepatitis C screening and treatment. And in the Levant, researchers in Lebanon and Jordan are increasingly collaborating on regional health studies, for example, investigating the surge of hepatitis A in sanitation-deprived communities or the impact of long COVID, frequently with support from WHO's Eastern Mediterranean Regional Office. Overall, this week underscored how Middle Eastern nations are leveraging research and innovation not only to solve local health issues but also to contribute to global medical knowledge, whether through atlas-scale biology projects or policy-shaping clinical studies. Biotech and pharmaceutical developments are next to discuss. Middle Eastern countries continue to pursue growth in their biotechnology and pharmaceutical sectors, using a mix of domestic production initiatives and international partnerships to improve drug availability and innovation. Iraq and Saudi Arabia deepened their cooperation in healthcare and pharma manufacturing as part of a broader economic rapprochement. Iraqi Health Minister Dr. Saleh al-Hasnawi, in remarks to state media, confirmed that Iraq has joint projects underway with Saudi Arabia to establish new health centers and pharmaceutical production facilities in Iraq. This collaboration, outlined in a January agreement, is now moving forward with technical teams planning the construction of modern clinics and at least one pharmaceutical factory with Saudi investment and expertise. The initiative is a facet of Iraq's strategy to rebuild and modernize its healthcare infrastructure post-conflict, while also benefiting from Saudi Arabia's advanced pharma industry. The kingdom hosts several regional drug manufacturers. Iran is likewise asserting itself as a regional pharmaceutical supplier. Iran's first vice president declared that Tehran is ready to meet Iraq's pharmaceutical and medical supply needs, highlighting Iran's robust drug production capabilities and the opportunity for joint cooperation. Iran has a substantial generic pharmaceutical industry and has invested in biotech, producing biosimilars, insulin, and even COVID-19 vaccines domestically. By offering support to Iraq, Iran aims to expand export markets for its medical products and strengthen political-economic ties. This week saw Iranian officials emphasizing self-sufficiency in medicine, a long-held goal amplified by sanctions, and promoting regional self-reliance whereby Middle Eastern countries trade medical goods and reduce reliance on Western imports. In the United Arab Emirates, efforts to enhance pharmaceutical supply chain integrity and biotech innovation were highlighted. Abu Dhabi's Ministry of Health and Prevention continued rolling out Tatmin, the UAE's advanced track and trace platform for medicines, which uses GS1 barcoding standards to ensure the authenticity of pharmaceuticals from factory to pharmacy. Tatmin, Arabic for assurance, was cited this week as a key tool in combating counterfeit drugs and improving recall efficiency, part of the UAE's commitment to leveraging technology for patient safety and trust in the drug supply. On the biotech front, Dubai hosted investors exploring growth in genomics and precision medicine startups, building on the momentum from UAE-based ventures like G42 Healthcare's genomics program and recent plans to manufacture advanced therapies locally. Bahrain and Qatar also signaled interest in growing their biotech sectors. Bahrain's Economic Development Board has been courting companies in vaccine production and medical devices, following the success of its COVID-19 vaccine collaboration with the UAE's Hayat Biotech, and Qatar's research institutions are incubating biotech innovations in diabetes and maternal-fetal health through Qatar Foundation initiatives. While no single blockbuster deal was announced during the week, there is a clear trend of incremental progress. For example, Libya's health ministry revealed in March that it's in talks with Iraq to partner on pharmaceutical procurement and possibly co-development of medicines, hinting at wider regional networks for bulk buying and production. At a regional level, the Middle East is increasingly focused on health security and local production of essential medicines and vaccines. The GCC countries, through joint committees, exploring harmonization of drug registration and pooled vaccine procurement to leverage economies of scale. The World Health Organization, WHO, commended several Middle Eastern countries for establishing domestic vaccine manufacturing lines or fill and finish facilities as a lesson from the COVID-19 pandemic. Notably, the UAE and Saudi Arabia are backing plans for an Arab Vaccine Center, proposed under the Arab League's Health Council, to coordinate research and production of vaccines in the region. Egypt, which already manufactures insulin, hepatitis C treatments, and COVID-19 vaccines under license, announced earlier this year a goal to become the pharma hub of Africa, and during this week Egyptian officials reiterated support for local production of oncology drugs and insulin pens through public-private partnerships. In Jordan, the well-established generic drug industry, one of the country's export pillars, continue to grow, with Jordanian firms signing new export deals to Asian and African markets. One notable humanitarian pharma collaboration launched recently involves the UAE and WHO focusing on malnutrition therapeutics. The UAE provided funding and logistical support to WHO to supply ready-to-use therapeutic foods and micronutrient supplements in Yemen's Socotra Island as part of a malnutrition reduction program. This initiative, while primarily a nutrition project, has a pharmaceutical component in the form of supplementation and exemplifies how regional contributions are addressing health crises. Lastly, regulatory updates emerged. Saudi Arabia's FDA has been streamlining clinical trial regulations to attract more biotech research, and Lebanon, despite its crises, approved several new generic medications to address shortages. In summary, the week underscored a regional drive toward enhancing pharmaceutical sovereignty and innovation, by building factories, adopting verification tech like TAPMIN, and leveraging alliances, both intra-Middle East and with global partners. Middle Eastern countries are laying groundwork for more robust biotech and pharma sectors that can better serve their populations and respond to future health challenges. Public health challenges and disease outbreaks is the next pressing area to discuss. Public health challenges were at the forefront of regional attention, as Middle Eastern countries contended with both successes and setbacks in managing disease outbreaks and health emergencies. In Saudi Arabia, the week marked the aftermath of a successful Hajj pilgrimage season from a health standpoint. The Saudi Ministry of Health announced that the health status of Hajj pilgrims was reassuring, with no epidemic outbreaks or contagious diseases reported among the 1.8 million participants. Officials celebrated the outcome as a validation of strict preventive measures including mandatory vaccinations for meningitis, COVID-19, yellow fever, and polio, and the "no permit, no Hajj" rule that limited the pilgrimage to eligible, health-screened individuals. Over 125,000 healthcare services were provided during Hajj at hospitals and clinics in the holy sites, and Saudi health authorities noted a 90% reduction in heat-related illnesses this year due to extensive awareness campaigns and on-site measures like misting fans. The kingdom's ability to conclude Hajj without any infectious disease outbreaks was a significant public health achievement, given past concerns about mass gatherings. It aligns with Saudi Arabia's broader health transformation program goals and was praised by regional partners. Neighboring Gulf states sent observers to learn from Saudi best practices in mass event health security. However, in several countries public health threats remained acute or worsened. Gaza, Palestine, is facing an escalating humanitarian health disaster amid ongoing conflict. On July 9, doctors at Gaza City's Al-Shifa hospital, the largest in the Strip, issued dire warnings that a critical fuel shortage is on the verge of paralyzing hospital operations. The hospital's director, Dr. Mohammed Abu Salamiyah, cautioned that if fuel runs out, life-saving equipment will stop, oxygen stations will stop working. A hospital without oxygen is no longer a hospital. The hospital could become a graveyard for those inside, he said bluntly. Already, Al-Shifa has shut down its dialysis unit to conserve power for ICUs and emergency surgeries. Doctors are performing procedures without proper lighting or air conditioning, with perspiration dripping into patients' wounds. The World Health Organization, WHO, reported that after 21 months of war in Gaza, only half of Gaza's 36 hospitals are still partially functional. More than 600 attacks on health facilities have occurred in the conflict, and health workers describe the system as on its knees, with severe shortages of fuel, medical supplies, and personnel. Gaza's health ministry says over 57,000 Palestinians have been killed in the war, and the destruction of infrastructure has led to outbreaks of diarrhea and other illnesses on top of war injuries. This week, humanitarian agencies like UNICEF and the ICRC intensified calls for a ceasefire and for fuel and medical aid to be allowed into Gaza to stave off hospital collapse and preventable deaths. Lebanon's public health crisis deepened as its healthcare system, crippled by economic collapse, struggled to contain communicable disease upticks. The Ministry of Health in Beirut reported an increase in waterborne and foodborne diseases, notably viral hepatitis A, in impoverished communities suffering from contaminated water and poor sanitation. Recent statistics show Lebanon has seen a sharp rise in hepatitis A infections compared to previous years, a direct consequence of the breakdown in basic services like waste management during the financial crisis. Public health experts warn that crowded living conditions, fuel shortages, affecting water pumps, and inflation, reducing households' ability to boil or buy clean water, have created a perfect storm for disease outbreaks. NGOs in Lebanon are scrambling to run hygiene campaigns and vaccination drives. The Lebanese Red Cross this week distributed water purification tablets in some areas after clusters of Hep A and severe gastroenteritis were identified. Meanwhile, Lebanon's vaccine shortages, for routine immunizations, pose a further threat. Health officials noted that diphtheria and measles cases could also re-emerge if vaccine coverage continues to drop. The situation underscores how Lebanon's economic freefall has translated into a full-blown public health emergency, reversing many health gains of the past decades. In Syria, overlapping crises, conflict, displacement, and infrastructure devastation continue to fuel public health challenges, especially a persisting cholera outbreak that has concerned health agencies for over a year. As the region entered the height of summer, the International Blue Crescent and other aid groups warned that cholera risks are rising again in Syria due to the warmer weather, water shortages, and population movements. Between August and December 2024, Syria had officially recorded 1,444 suspected cholera cases and 7 deaths across multiple governorates, and sporadic cases have continued into 2025, particularly in the northwest and northeast where water and sewage systems are damaged. This week relief organizations issued a flash appeal noting that disruptions to water systems and precarious sanitation in camps could spark a larger cholera wave in the coming weeks. They stressed the need for more chlorine tablets, tankered clean water, and community hygiene education to prevent an outbreak from getting worse over the summer months. At the same time, WHO officials highlighted the broader humanitarian health toll in Syria. Over 416,000 Syrian children are acutely malnourished, greatly increasing their susceptibility to diseases like cholera and measles. WHO's representative in Damascus pointed out that more than half of Syrian children under 5 also miss routine immunizations, raising fears of vaccine-preventable disease outbreaks. A small number of polio cases in 2022 in Syria's northeast remain a cautionary tale. Syrian hospitals, many of which lack reliable electricity or supplies, are ill-equipped to handle new epidemics. Efforts are ongoing to carry out oral cholera vaccination campaigns in high-risk areas, over 850,000 Syrians targeted, but funding and access constraints make the response difficult. Yemen remains one of the world's most daunting public health emergencies. During the week, UNICEF and Doctors Without Borders, MSF, drew attention to surges in severe acute malnutrition in Yemeni children alongside continuing disease outbreaks. An estimated 1.8 million Yemeni children are malnourished, including nearly 400,000 at risk of dying from severe acute malnutrition, a statistic unchanged since last year. This dire malnutrition crisis has left Yemen's population extremely vulnerable to infectious diseases. The country's long-running cholera epidemic, the worst globally in recent history, is still active, although incidents had fallen from its 2017 peak. WHO noted an increase in suspected cases since June in parts of Yemen. Health centers are again reporting thousands of cholera cases per week in some districts, a situation worsened by seasonal rains and the collapse of water infrastructure. Additionally, a measles outbreak has been sweeping through Houthi-controlled northern Yemen due to low vaccination coverage, with dozens of child fatalities reported. UNICEF officials warned that malnutrition and disease are feeding into each other. Undernourished children have weaker immune systems, and repeated infection further exacerbates malnutrition. For example, in Yemen's government-controlled south, cases of cholera and measles spiked simultaneously in areas with the highest malnutrition rates. In response, the WHO and UAE launched a special program on Socotra, an island largely spared from fighting but facing food insecurity, to deliver nutritional supplements and bolster maternal child health services. Cholera vaccination drives, when possible, are ongoing. About 540,000 Yemenis were targeted in Hodeidah and Id for oral cholera vaccine, with around 72% uptake in the first round. Nonetheless, Yemen's public health situation remains extremely fragile, reliant on massive humanitarian aid to prevent large-scale loss of life from hunger and epidemics. On a more positive note, regional coordination and preparedness measures showed their value in certain instances. Health ministries across the Middle East took part in World Hepatitis Day awareness planning for the upcoming July 28, sharing strategies to combat hepatitis B and C. The GCC Early Warning Center for Public Health, based in Riyadh, monitored disease trends and issued a bulletin noting no significant cross-border disease spread during the week, thanks in part to robust surveillance around events like Hajj. Some countries saw localized improvements. Jordan, for instance, recorded 0 new COVID-19 ICU admissions this week, a symbolic milestone indicating the pandemic's retreat due to high vaccination rates and natural immunity. And in Iran, despite ongoing economic sanctions, the health ministry managed to contain a seasonal flu uptick through a timely vaccination push in at-risk groups. The minister reported flu vaccine distribution exceeded 1.5 million doses nationally. The week's disparate public health outcomes, from Gaza's looming hospital blackout to Saudi Arabia's smooth Hajj health operation, underscored the region's vast challenges and successes. They highlighted the importance of sustained public health investment, conflict resolution, and international support in addressing the Middle East's persistent outbreaks and health system crises. Always important is wellness and health promotion. Governments and organizations across the Middle East continue to champion wellness and health promotion initiatives aimed at improving lifestyles, preventing disease, and addressing emerging health risks. Kuwait launched a novel public awareness campaign linking health promotion with environmental action. On July 10, the Ministry of Health rolled out a summer-long initiative titled Enhance Your Health with Climate Change, under the patronage of Health Minister Dr. Ahmed Al-Awadhi. The campaign's goal is to educate the public about the health impacts of climate change, such as heat-related illness and air pollution, and to encourage behaviors that protect both personal health and the environment. In partnership with a local shopping mall and NGOs, the ministry set up interactive exhibits, workshops, and lectures highlighting topics like preventing heat stroke during Kuwait's extreme summer temperatures, reducing air pollution exposure, and conserving water to prevent vector-borne diseases. Dr. Al-Muntha Al-Hassawi, Kuwait's Assistant Undersecretary for Public Health, noted that climate change is now a lived reality in Kuwait, with record high temperatures in recent years, and said a national committee is developing policies to mitigate health effects of climate extremes. Meanwhile, Dr. Abi Al-Baho, head of health promotion, explained that the campaign is focusing on heat stress, air quality, and eco-friendly practices, using youth-oriented activities and social media challenges to engage the public. Kuwait's effort reflects a growing regional recognition of climate change as a public health issue. Other Gulf states are likely to adopt similar climate and health messaging ahead of the COP28 summit being hosted in the UAE later this year. Several countries intensified tobacco control and healthy lifestyle campaigns. In the UAE, a new measure to aid smoking cessation was in the spotlight. As noted, the government has legalized tobacco-free nicotine pouches effective July 29, with health officials framing it as a harm reduction strategy to help smokers quit cigarettes. These oral nicotine pouches, which contain nicotine but no tobacco, will now be regulated and sold legally, a move the Ministry of Health says provides smokers with a less harmful alternative to satisfy nicotine cravings while avoiding the carcinogens of tobacco. To accompany this policy, the UAE has launched educational drives about the proper use of nicotine replacement therapies and is expanding smoking cessation clinics. This aligns with the UAE's broader commitment to reducing smoking prevalence under its national well-being strategy. Additionally, Dubai's municipality has been enforcing stricter smoking bans in public parks and beaches during the summer, and running a Quit and Win program that offers incentives for Emiratis who quit smoking for 30 days. Mental health and community well-being remained key themes. The UAE continued its year of community initiatives, many of which have a wellness dimension. Emirates Health Services, EHS, recently opened 15 new mental health clinics integrated into primary care centers across 6 Emirates as part of the Together for Mental Well-Being program. This week, EHS reported that these clinics, staffed by trained family physicians and visiting psychiatrists, have already reached thousands of patients, providing early counseling and treatment for conditions like anxiety and depression in a friendly, neighborhood setting. The initiative's aim is to reduce stigma around mental illness and make mental health care as accessible as a family doctor visit, thereby improving overall community wellness. Public messaging on mental health, through social media influencers and mosque sermons talking about stress management, complemented the clinical side. Qatar also emphasizes wellness through its national sport and fitness campaigns, though summer heat has moved many activities indoors. For example, the The Qatar Active Schools program is ongoing through summer camps, ensuring children stay physically active during school holidays as a measure against childhood obesity. Nutrition and food safety were other pillars of wellness promotion. Oman issued advisories for citizens traveling during summer vacation, urging them to eat safe while traveling to avoid foodborne illnesses. The Ministry of Health and Ministry of Tourism in Muscat jointly released tips on consuming bottled or boiled water abroad, washing fruits, and being cautious with street food, as many Omanis travel to destinations where hygiene standards might differ. This travel health awareness is part of Oman's health promotion strategy to reduce illness among nationals overseas and upon return. In Bahrain, the Ministry of Health's Nutrition Department used local media to encourage healthy eating during the hot season, advising light, hydrating foods, like fruit, yogurt, and soup, and warning against excessive caffeinated drinks that can cause dehydration. Saudi Arabia and Iran both marked World Breastfeeding Week early, with preparatory workshops this week, training healthcare workers to promote exclusive breastfeeding for the first 6 months of life, in an effort to improve infant health and maternal bonding. Regional religious and cultural contexts were also leveraged for wellness. In Saudi Arabia, as part of the Hajj health precautions, authorities ran an anti-smoking campaign in the holy sites, offering pilgrims free nicotine patches and advice aligning the spiritual cleansing of Hajj with quitting smoking. Similarly, Jordan's Ministry of Health collaborated with the Ministry of Awaq to have mosque imams deliver Friday sermons about the importance of vaccines and healthy habits, linking caring for one's body to religious duty. Palestinian health NGOs in the West Bank organized community walks and distress sessions in parks for families affected by violence, focusing on mental wellness. Finally, heat safety and labor welfare received attention given the region's extreme summer conditions. The UAE and Qatar enforced their annual midday work bans on outdoor labor from 12:30 p.m. to 3 p.m., which continued through this week and will run until mid-September. These policies are meant to prevent heat stroke and dehydration in outdoor workers. UAE's Ministry of Human Resources reported hundreds of inspections to ensure compliance, with hefty fines for violators. Medical professionals noted that since the midday break rule was instituted, heat-related hospital admissions among workers have significantly dropped. Alongside this, educational campaigns instruct workers on hydration, recognizing heat exhaustion signs, and using cooling towels. Kuwait and Oman also issued public heat advisories, urging everyone, especially those fasting the optional summer Ashura fast or working outside, to stay hydrated and avoid peak sun hours. In summary, the week demonstrated a robust regional effort in health promotion, whether through public campaigns on climate and health, regulatory moves to facilitate healthier choices, like quitting tobacco, mental health integration, or seasonal wellness advisories. These preventative health and wellness initiatives complement the more acute care and policy measures, aiming to foster healthier communities and reduce the burden of chronic and lifestyle-related diseases over time. Digital health innovation, a topic always full of developments. Digital health innovation continued to accelerate in the Middle East, as countries deployed new technologies to improve healthcare delivery, streamline administration, and enhance patient outcomes. In the UAE, the push towards e-governance in health saw a tangible step this month. Residents can now obtain and attest sick leave certificates entirely online via smart platforms. The UAE's Ministry of Health and Prevention, working with the Telecommunications and Digital Government Authority, introduced this digital sick leave system to eliminate paper forms and clinic visits solely for documentation. Doctors upload medical reports to a portal where patients and employers can access them, and the reports are automatically verified with a digital attestation stamp. This innovation reduces bureaucratic burden on healthcare facilities and patients, exemplifying the UAE's broader trend of leveraging digital solutions for efficiency, which also includes electronic medical records and a national patient portal. Meanwhile, Saudi Arabia showcased the life-saving potential of artificial intelligence in healthcare. During the Hajj season, Saudi health authorities utilized an AI-powered diagnostic system by unit to assist in analyzing pilgrims' chest X-rays for signs of infectious disease. The AI tool, implemented in hospitals in Mecca and Medina, could rapidly detect abnormalities indicating tuberculosis, pneumonia, or Middle East Respiratory Syndrome, MERS, allowing for quicker isolation and treatment of any suspected contagious cases. Health officials reported that this augmented diagnostic capability significantly enhanced screening throughput, critical when over 1 million pilgrims passed through the clinics, and is part of Saudi Arabia's investment in digital health surveillance to protect mass gatherings. The successful use of AI in radiology at Hajj is expected to pave the way for broader adoption of medical AI in Saudi hospitals, in areas ranging from triaging patients to managing chronic disease imaging. Oman made strides in digital health infrastructure, particularly in health insurance and data management. The Sultanate officially launched Damani, a national electronic platform for health insurance claims and information exchange, as it prepares to implement universal health insurance, mandate health insurance, for residents. Damani provides a unified digital system linking insurers with healthcare providers, facilitating real-time approvals, e-claims, and secure sharing of medical data. By creating an integrated network, Oman aims to reduce paperwork, prevent insurance fraud, and speed up reimbursement processes, ultimately improving patient experience. The health minister noted this week that once Damani is fully operational, patients will be able to use a smart card or app at any hospital or clinic, where providers can instantly verify coverage and submit claims online. Jordan also took concrete steps towards health sector digital transformation. The Ministry of Health in Oman, in collaboration with the Ministry of Digital Economy and Entrepreneurship, launched a comprehensive evaluation of digital readiness in all public hospitals and health centers. Teams began assessing infrastructure like network connectivity, current use of electronic medical record (EMR) systems, and staff IT training needs across the kingdom. This digital audit is part of Jordan's plan to fully digitalize public healthcare by end of 2024, building on the long-running Hakim program, a collaboration with the Electronic Health Solutions Company, which has already introduced EMRs to many facilities. Notably, the Hakim program's achievements were highlighted. 285 health facilities in Jordan have been digitalized over the past 15 years, including Ministry of Health hospitals, Royal Medical Services sites, and clinics, with thousands of doctors and nurses now using the system daily. Hakim's platform, Hakimi, allows clinicians to access patient histories, lab results, and radiology images electronically, which has improved care coordination and cut down waiting times for records. By auditing and closing the gaps in remaining facilities, Jordan aims to have a seamless national e-health network. This week, officials mentioned that popular services like the My Hakim medication home delivery app, which saw expansion to over 180 facilities, rely on this digital backbone. Bahrain continued to expand its digital health initiatives as well. The kingdom's top e-health project, the National Health Information System, ISEHA, and the connected Muharakati digital appointment system, has now linked all primary health centers, allowing patients to book GP appointments via a mobile app and access their lab results online. During the week, Bahrain's Information and E-Government Authority reported that uptake of the Sehati app, which provides a range of health e-services, grew by double digits in the first half of 2025, indicating more people are embracing teleconsultations and e-prescriptions. Qatar is similarly integrating digital innovations. The country has been piloting telemedicine follow-ups for diabetes and mental health patients. This week, Hamad Medical Corporation noted high patient satisfaction with video consultations for routine check-ins, an important feature especially in summer when travel or heat might impede clinic visits. Qatar is also investing in electronic health record (EHR) enhancements. Its nationwide Cerner EHR system is being upgraded with advanced analytics capabilities to predict patient readmission risks and streamline care pathways. Cross-border collaborations in digital health were also evident. The GCC's unified track and trace system for medications, akin to the UAE's Tatmin, was reportedly discussed in a meeting in Riyadh, aiming to implement a GCC-wide platform that can trace medicines through a single database to prevent counterfeit drugs regionally. Additionally, whose EMRO office hosted a workshop, June 9 to 10 in Tehran, on developing Iran's national immunization strategic plan with digital tools, focusing on how electronic registries and SMS reminders can increase vaccination coverage in Iran. Iran's health ministry is looking at successful models from the UAE and Oman for digitizing immunization records so that children's vaccine schedules are tracked electronically, an effort that will likely get support under WHO's digital health initiatives. Finally, innovative pilot projects dotted the region. In Egypt, A startup hackathon held in Cairo on July 7 to 8 brought together tech entrepreneurs to develop AI solutions for public health problems. The winning team created a prototype of a chatbot that can triage mental health queries and connect users to the nearest available therapist. In Lebanon, despite the crises, young developers are working on a platform called Symptomatica that leverages crowdsourced data to map disease symptom trends and might provide early warning of outbreaks. Lebanese coders hope to partner with the Ministry of Public Health to test it amid the hepatitis A surge. Lastly, let's discuss population health management. Population health management efforts, programs and policies designed to improve health outcomes for whole communities saw significant developments in the region as countries work to expand insurance coverage, strengthen preventive care, and target vulnerable groups with specialized interventions. In the UAE, authorities are in the midst of implementing a landmark nationwide health insurance scheme that extends basic medical coverage to all employees and domestic workers across every emirate. Launched by federal decree earlier in the year, this week saw continued awareness campaigns and final regulatory preparations for the scheme's full activation. Under the plan, every private sector and household employer must provide a mandatory insurance package, priced at AED 320 per year, for any worker not already covered in Abu Dhabi or Dubai's existing programs. The basic policy covers essential inpatient and outpatient care with copay limits, and will bring into the fold hundreds of thousands of workers in the Northern Emirates who previously had no health insurance. UAE officials underscore that this initiative, part of the country's aim for universal health coverage, will ensure low-income expatriate workers have access to healthcare and will reduce the financial burden of illness on families. By setting a low, fixed premium and pooling risk nationally, the government expects improved health outcomes through earlier treatment and better preventive care for the covered population, as well as enhanced competitiveness of the labor market via a more equitable benefit structure. The week's media coverage included explainers for employers on how to enroll workers and spotlight stories of laborers now able to afford treatment for chronic conditions thanks to the new insurance. Chronic disease prevention and management, especially cancer and diabetes, remained a priority area in population health strategies. Qatar's comprehensive approach to cancer control was validated by the Lancet Oncology study released at the end of June. As mentioned, the study highlighted that Qatar's sustained investment in a national cancer framework since 2011, including free screening programs, breast, bowel, and the establishment of specialized treatment centers, has led to measurable improvements in patient survival and care quality. For example, thanks to awareness campaigns and mammography, over 65% of breast cancer cases in Qatar are now detected at early stages, significantly boosting survival rates. The Qatar Cancer Plan 2023 to 2026 builds on this by focusing on closing gaps such as improving cancer literacy among the public, to encourage timely checkups, and expanding palliative care services. Public health officials in Doha used the occasion to remind the community about the importance of screening. Via text message blasts and primary care reminders, they encouraged residents to participate in the free national Screen for Life program, which covers breast, bowel, and cervical cancer screenings. Likewise, Bahrain has been proactive in cancer screening as a population health measure. This week, the Royal Medical Services in Bahrain continued its national colorectal cancer screening campaign that was launched in March, urging citizens and residents over age 45 to undergo a free fecal immunochemical test, FIT, for early detection of colon cancer. Public hospitals like King Hamad University Hospital and Salmania Medical Complex are offering walk-in screening, and initial results from the campaign, which included an awareness exhibition in a mall, have been positive. Dozens of precancerous polyps have been identified and removed from asymptomatic individuals. Bahrain's program is collaborative, involving not just hospitals but also the Bahrain Cancer Society and local NGOs to maximize outreach. It reflects a growing regional trend to incorporate preventive screenings into standard healthcare, thus managing population health by catching diseases early. Maternal and child health indicators are a key focus of population health management in conflict-affected and low-resource settings. On June 1, WHO and the UAE launched a joint humanitarian program on Yemen's Socotra Island to tackle severe malnutrition among mothers and children, an effort that continued into this week with the deployment of specialized teams to remote villages. This program provides nutritional screening for every child under 5 on the island, distribution of ready-to-use therapeutic food for those who are moderately or severely malnourished, and nutrition supplements, like iron and folic acid, for pregnant and lactating women. Reducing maternal and child mortality caused by malnutrition is its goal, via a comprehensive plan spanning feeding programs, clean water provision, and community education. Given Socotra's isolation and the strain of Yemen's protracted crisis, this targeted intervention is effectively a population health management approach for the island's entire populace, around 60,000 people. Preliminary reports this week noted that hundreds of children have already been enrolled in feeding programs and that community volunteers are being trained to monitor growth of infants over the coming months. Immunization and infectious disease control remain at the heart of population health initiatives. Iran, for example, held a workshop to craft its National Immunization Strategic Plan, 2025 to 2030, with input from WHO and other countries' experiences. With a large, distributed population, Iran is planning improvements like introducing electronic vaccination registries to ensure children across provinces get all doses on schedule, and potentially adding new vaccines, such as pneumococcal conjugate vaccine, to its national schedule. This week, Iranian health officials emphasized maintaining Iran's polio-free status and improving measles vaccination coverage, targeting remote and nomadic populations as part of the new strategy. Iraq made note of having fully transitioned its polio program into routine healthcare, becoming the first polio transition country to do so, meaning resources and staff once dedicated to polio eradication are now being repurposed to strengthen general immunization and outbreak preparedness, a boon for population health. In the Palestinian territories, the Ministry of Health in Ramallah announced the launch of a drive to vaccinate all children under 5 in refugee camps against measles and rubella, after some immunity gaps were identified due to pandemic disruptions. The campaign, supported by UNICEF, aims to reach 35,000 children in West Bank camps and is a preventive step to avert potential outbreaks, thus protecting the wider community. Health education and community engagement are also integral to population health management. Egypt's Youth and Health Ministries held sessions, as referenced mid-June, with young Egyptians in a Senate simulation program to include youth voices in shaping health policy priorities, such as preventive health, reproductive health education, and anti-drug campaigns. The idea is that empowering the next generation to participate in policy ensures programs are better tailored to population needs and that healthy practices are promoted peer-to-peer. Saudi Arabia continued to expand its Healthy Cities program, which was mentioned as part of Vision 2030. This week, 2 additional Saudi municipalities, one in the eastern province and one in Al-Qasim, were accredited by WHO as healthy cities after meeting criteria on environmental health, community fitness facilities, and chronic disease prevention programs for residents. These localized efforts contribute to national population health by creating supportive environments for wellness, for instance, smoke-free public spaces, walking trails, and active school programs. Finally, health financing reforms underpin many population health efforts. In Bahrain, steps are being taken toward implementing Doctors' Diagnosis-Related Group (DRG) payment systems in the new national health insurance, which incentivize efficient, high-quality care across the population. And as described, Jordan's ISF arrangement with the IMF will channel funds into health system strengthening that benefits the whole population by ensuring preparedness for health threats. The region clearly recognizes that managing the health of populations, not just individual patients, is key to sustainable healthcare. Whether through universal insurance, preventive screenings, nutritional interventions, or vaccination campaigns, Middle Eastern countries are striving to improve aggregate health outcomes. Despite challenges like conflict and funding constraints in some areas, these population health initiatives lay the groundwork for longer, healthier lives across the diverse communities of the Middle East. Let's now summarize and conclude this week's review. This week's developments illustrate a Middle Eastern health landscape defined by dynamic progress amid persistent areas of opportunity. In the more stable and prosperous countries, we observed energetic drives to reform health financing, expand services, and adopt cutting-edge innovations, all pointing toward a future of high-quality, technology-enabled healthcare accessible to all citizens and residents. Gulf states like the UAE, Saudi Arabia, and Qatar exemplified this forward momentum, whether through the UAE's nationwide insurance rollout, Saudi Arabia's swift Hajj health achievements and hospital expansions, or Qatar's strides in research and cancer care excellence. These initiatives reflect a regional trend of governments making health a pillar of national development, investing oil wealth and strategic focus into well-being and medical advancement. At the same time, the stark disparities in the region were equally evident. In conflict-ridden and economically distressed areas, Gaza, Yemen, Lebanon, Syria, health systems remained in crisis, underscoring the toll of war and instability on population health. Hospitals in those places are overwhelmed or failing, preventable diseases are resurging, and malnutrition is robbing a generation of its future. Yet, across this spectrum, a common thread is a determination to improve health outcomes. We saw regional collaboration in action, GCC countries uniting on drug control and disease surveillance, and neighbors like Egypt and UAE stepping up to aid war-torn populations, and we saw communities taking health into their own hands, youth advocacy in Egypt, climate health awareness in Kuwait, volunteerism in Saudi Arabia's Hajj and beyond. Pandemic threats, climate impacts, and migration of refugees demand a collective approach, and encouragingly, there were signs of such an approach. The IMF WHO pandemic preparedness support for Jordan could serve as a model for other nations, and initiatives like the UAE WHO malnutrition program in Yemen show the power of partnerships. Moving forward, the region's health trajectory will depend on sustaining the policy momentum in the well-resourced states while finding ways to stabilize and rebuild health systems in crises. Investment in public health fundamentals, clean water, vaccination, primary care, is as urgent as ever in places like Syria and Yemen, even as investment in precision medicine and AI continues elsewhere. The Middle East's youthful population and its cadre of talented health professionals are assets that, if supported, can drive improvements in all countries. In sum, the week brought both hope and sobering reality. Hope in the form of new laws, new clinics, and research breakthroughs that promise healthier futures. The major trends, digital transformation, emphasis on prevention, expansion of coverage, and resilience building, are likely to continue and even accelerate, as Middle Eastern nations, individually and collectively, strive to deliver on the goal of healthier populations. Nonetheless, by the close of this week, the overarching narrative is one of a region in flux. Innovation and dedication are pushing the health sector forward, even as ongoing conflicts and inequities pose challenges. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.